Hi everybody, welcome to MG Life Hacks. I started this channel because I have generalized myasthenia gravis, which is a neuromuscular disease that affects your involuntary and voluntary muscles, and it causes extreme weakness that can be potentially dangerous, very, very dangerous if it's not carefully managed. Since it is relatively rare, it's kind of difficult to find certain pieces of information, and it's a little bit of a challenge, especially when it comes to movement and how to increase moving around and activities and getting more out of your day. And I'm about to try and cover a little bit of physical therapy, which for me was a little terrifying to try and consider, and figuring out how I would be able to do it and accomplish it, because I'm trying to avoid hip surgery. Let's hope. So the first thing that I did was, after I got the order from my doctor who was looking at my hips and the MRI and everything, he said, "You're going to need physical therapy." Now, I'm not entirely sure how you're going to do that given the myasthenia gravis, so you'll want to speak with your neurologist. Definitely. So I spoke with my neurologist, who specializes in neuromuscular diseases. He's very familiar with myasthenia gravis, ALS, and things of that nature. He gave me the all clear with a caveat, and that was to be extraordinarily careful. So I reached out to the physical therapy location that they referred me to. I spoke with several different people there just to make sure that for my appointment, I would have a little bit of time with the physical therapist to explain myasthenia gravis and how it might impact the treatment. After that, we discussed sliding scales, and I discovered that although most doctors typically recommend physical therapy a few times a week, I basically won't be able to do that because of my particular symptoms and weakness and things like that. But what I do is I went to my appointment, the first appointment, and I got a printout of the different stretches and like one exercise. Basically what they did was just made the repetitions a lot lower and the sets a lot lower as well. And if you've never done physical therapy, it's 5 repetitions, for some of my stretches, it's 5 repetitions of one particular exercise for one particular set. Now, what I do when I get home is, since I'm not able to do all of those at the physical therapy office, just because of, weakness, and I don't want to poke the bear, is I spread it throughout the entire day. So, just to try and explain it a little bit more, I hope this makes sense for everybody, is one stretch that I do, and I do 5 repetitions of that stretch, and then I rest and give my body a chance to build the strength back up. And then I do another set of 5 of that stretch, because she told me 2 sets of 5. Perfect. I'm done with that stretch. And then I take a break from that, and then I'll come back to another exercise or stretch at a later time during the day. Now, what I also ran into when I started doing this is, since I was adding an activity that my body wasn't acclimated to yet, is, potential flare-up types of symptoms. Like mine, I start to feel sick, like I'm starting to get a flu. It also kind of feels hollow in my chest, kind of like I'm a little short of breath. What can also happen, and this is when I know I'm pushing a little too hard for that particular muscle group, is if that muscle, or that like my legs in this case, start to tremble a little bit. That's how I know I've pushed myself a little bit too far and I need to stop. So while you're doing this, pay attention to your body and what it is telling you. What you can also do in order to accomplish those exercises, because it's physical therapy, it's necessary. If you're not able to add on those activities safely, what you can do is swap out activities. For example, in order for me to accomplish, one day I was just not feeling 100% good enough to get by, but felt, I'm not gonna try and do anything crazy new today. I'm just gonna do things to get by type of feeling. What I did was I swapped out stairs, because I have stairs from my main floor to the bathroom upstairs and to the basement, and I try and do as much activity as I can get away with. So instead of doing that day, I just, found ways to stay on the main floor and limited my leg movement and, sitting up constantly. I'll try and, cut back on one in order to do the other. That's how I kind of balanced my activities out, and that's how I accomplish my physical therapy. I was able to increase the number of days that I was doing that particular activity. Instead of just doing it once a week, I'm now able to do it almost every day of the week. If I'm feeling tired, extra tired, you know your body best, take a day off from those in order to fully rest, because doing these makes me pretty tired. I was really pooped out at first, had to adjust a couple things, cutting back. That's when I started to figure things out, but that's how I am doing it, and so far it's working for me. What's also affected mine is if you get infusions, like I get Vyvgart, and I'm on a 4-week on, 4-week off cycle. I did not do this. So I recommend you do it if you are getting infusions. I started my physical therapy right before my next cycle started. So when I started physical therapy, I was particularly weak because, that's just, infusion cycles help your symptoms kind of do this instead of this. So I started on the downswing. What you might want to consider doing is waiting until your second dose or second infusion, when your strength is really starting to pick up speed again, just to feel a little bit less awful when you're trying to start physical therapy. Highly recommend it. Wish I had done it. The other thing to keep in mind is you may or may not burn through potassium. I have a good diet, don't get me wrong. I swear I eat my vegetables. I do eat spinach, fruits, veg, all that stuff. Cut back on a lot of carb. Anyway, potassium. I go through a little bit more now that I'm doing physical therapy. I know that I have low potassium because of how I physically feel, because I was hospitalized for low, potassium. They found in a blood test. So if you also have hypokalemia, or you're taking prednisone, I've heard that prednisone can cause hypokalemia. Like, I'm not a doctor, I'm in accounting, I'm a patient. So if you do need potassium, just be aware that if you have too much, it can also cause weakness and things like that. I just know my body feels a particular way when it needs something or needs to stop doing something. So just a heads up. When you are at the physical therapy office, but make sure you get the printouts of those exercises so that you can do them at home, and so you're not walking out of there thinking you're going to remember this stuff. Nope, not in my case. You will not remember. Let me think. Also, just as a patient, if you are new to your diagnosis and you're starting to do physical therapy because you really need to, be extra careful. Be extra careful in case you haven't figured it out already. This is not something you want to toy with. It's something you need to really be aware of how your body is communicating to you. Sometimes what will happen with mine anyway is when you push a little too hard, it might not affect you that moment. You might feel it the next day. If I have pushed myself very hard, which I accidentally did when I was trying to clean my oven, it didn't take much. It was 10 minutes of me just scrubbing an oven door, and I started to feel hollow in my chest, and then I started to feel really sick, and then I started to feel shortness of breath. Be very careful. If you're gonna do a new activity, you can always set a timer as well, maybe 5 minutes. Take it slow, take everything slow. Move slowly throughout the day. When you're doing, like when I do these exercises, I'm not blasting through. I am doing them very slowly because that's how I do more during the day. Because if I try and, just bust through and I'm just gonna, blast through these, no, take it slow. That way you can actually do the exercise and get it done that way instead. I know it's not quite the way you might be used to, but it's a big adjustment. Just be really careful. But those are my tips. I hope this helps someone. If this did not help you, I really hope that you find what you're looking for out there. There are also Facebook groups for myasthenia. You can also search and see what their tactics work to see if somebody has recommendations or suggestions that work for you. Myasthenia.org is also a great resource just in general as well. But good luck. Take care.